Now, the burden of the NCDs is immense in India. If you look at the India landscape, the burden of NCD on a daily basis is increasing day by day. Now, percentages wise, it impacts 68% of the population, as well as on a daily basis, we are seeing increased footfalls in our PHCs and all the hospitals across India. It's an increasing burden, and we really need to take it very seriously to curb its pace, as well as a lot of initiatives needs to be taken place at all the levels, at the policy level, at the practitioners level, at the public level, the 3 Ps that I actually call, to actually make sure that this burden is getting relieved day by day. See, at IIT Delhi, we actually focus on the last mile impact. So, we focus on the social impact. That's our vision with which we actually work on. And that is why we have started this QEI initiative at IIT Delhi, where we talk about the quality of the delivery, the equity aspect, as well as the inclusiveness aspect. And to be very frank, we advocate the PARTS strategy for actually dealing with the public health issues. And I'll elaborate what PARTS is, where P stands for players. We need to identify and bring upon all the different players, whether those are policymakers, whether those are practitioners, whether those are NGOs, whether those are academicians, on a single platform to actually make sure that they all are working in synergy to take these initiatives forward. The A of PART stands for added value. We need to make sure that we are not only adding value in terms of planning, but also implementing the initiatives that we are actually talking about. We need to understand the rules, because it's very important for our Asha sisters as well as the people who are working on ground at the end to not feel burdened with a lot of initiatives. And then we need to be very thoughtful in terms of the feedback, because we are implementing, there will be, and India is such a diverse country, because there are 4 vulnerable populations we deal with. And the 4 vulnerable populations are the people with the tribal in the area they are living in, the people who are elderly, those who are not abled, and also probably transgenders. We need to make sure that the 10th person in the line is able to access all the healthcare services that we are actually providing. And that is why the last part of S, that is of parts, is scope. We need to define the scope of our operations very, very carefully.